Welcome to the new Digital Primary Healthcare Panel Report. This video takes a quick look at the new digital version of the Primary Healthcare Panel Report and will help you with navigating this new experience. You will get an email with a link to your personalized report and your login credentials. This will have your username and password. Follow the link to access your personalized report and enter the credentials that you were provided. This is the login screen. Enter the username and password you were given in the initiating email. Note that the first time you log in, you will be asked to change your password. You will need at least one capital letter, at least one number, and at least one symbol. Once you have changed your password, you will have access to the report and will land on the home page. Be sure to remember your new password, as once you have changed your password, the one HQCA provided you will no longer work. Once you log in, you will land on the home page. Let's explore the different parts of this page. Clicking the back button will close the report you are viewing. Don't do it. Instead, we'll show you how to navigate in this environment. You will notice various tabs at the top of the page. The first ones we will discuss are the Home and Home Continued tabs. We split the home page into two to ensure readability and printability. Navigate between these two tabs to find your most pertinent information. What's New is where we will share with you new information or updates to the report. The next 6 tabs contain the different sections of the report. The Panel Report Toolkit gives you tools and resources to help you use and interpret the report, as well as information to help you dig deeper into the report results. It's a combination of quality improvement resources as well as orientation materials. You will also find the data dictionary here. About this report gives you information about how the report is created, where the data comes from, as well as the whys and hows of using the report. This report comes to you through the help and support of many partners like Alberta Health. The Acknowledgements tab lists these partners. Finally, Physician Default Settings gives information about you, the physician, including your PCN and zone. On the home page, you should see a welcome message. This message should contain the physician's name, that's you, your PCN, and zone. If you do not see this message, click on the Physician Default Settings tab to confirm your information. If the data under this tab is incorrect, then email primaryhealthcarereports@hqca.ca. After the welcome message, you'll see a summary of some of the key measures in the report. These are results from your active patient panel, specifically panel characteristics and preventive care. Green text in the table indicates you are in the top 16% of physicians in your zone for that particular measure. Orange text in the table indicates that you are in the bottom 16% of physicians in your zone for that particular measure. Note, there are no measures in this example that are orange. Near the bottom of the page, there's a link for you to view more results. Clicking on this link takes you to the Home Continued page. Just like on the home page, you'll see a summary of some of the key measures in the report. These are results from your active patient panel, except on this page you'll see results for chronic conditions, pharmaceuticals, and utilization. Should your results be more or less than 1 standard deviation above or below the zone mean, your results will be green or orange respectively. Remember, you can move back and forth between these pages using the tabs. One last thing to note about Home and Home Continued is that double-clicking on any of the measures will send you directly to that section of the report. There are 2 ways to get to a section. First, you can click directly on a measure on the Home and Home Continued pages. You can also click on the tabs at the top of the Home and Home Continued pages. In this example, let's click on the Preventive Care tab. This is the section index page. Just like a table of contents, the section index page lets you jump to each measure directly. Let's look at the left side of the section index page. This is the Home icon. Clicking on the Home icon will take you to the Home page. The Home page is where you can review your results at a glance. This is the question mark icon and is the report's help feature. It includes frequently asked questions, information about the report, and access to assistance from our team. Each of the 6 images below the Home and Help buttons represent different sections of the report. Clicking on any of the icons will take you to that specific report. For example, clicking on the Panel Characteristics icon will open the Panel Characteristics report. Notice that the Preventive Care icon is a different color. That is because you are currently in the Preventive Care report. This feature helps you orientate yourself as to where you are. In the main part of this screen, you will see the name of the section, all of the measures found in that section, the title of each measure with a graph of the measure below the title, and the data sources. The first time you navigate to a measure, you can get to the measure in one of 2 ways. You can click on the measure's title, or you can click on the measure's graphic image found below the title. Let's click on the diabetes screening title. You should know that the report loads all of your data and results for your PCN and zone in real time. This takes time. Hold tight. Let's have a look at the features found on the measure page. At the top of the screen, you should see information about you, the physician, including your practice ID. You will also see the default report settings. In this case, Calgary Foothills and Calgary are the defaults. If you'd like to change the PCN or the zone, click on Let Me Choose. Type any PCN and zone into the PCN and zone boxes. For this example, we will use the default settings. You can see that the tabs have changed as you've gone into the measure. These are all now links to the measures except Preventive Care, which is the section overview. This is your way back to the rest of the report. There are 3 parts to this page. The Interactions section on the left, the graph in the center, and the About the Measure box on the right. In the Interactions section, there are options to change the data in your report. Any changes you make in the Interactions section will be reflected in the graph. The dark purple color represents your panel. The lighter purple color represents your PCN. The blue color represents your zone. If you hover your mouse over each of the bars, more details about the calculation will appear. The About the Measure box contains information about your results, how they're calculated, and how to dig deeper into the results. This is the Home icon, which will take you to the home page. This is the Help icon. Clicking here will take you to FAQs, information about the report, and access to our team. The title of the measure and the measure's explanation are found here. The information that is bold is unique to the measure and tells you the data and date ranges. On the left-hand side of the measure screen, you have the opportunity to interact with your report by changing the variables. If you'd like to see different ages, simply move the circles to choose a new age range, or click on a circle to enter the age manually. If you'd like to filter for different patient characteristics, click on any of the boxes. A new graph will show your results with the change. If you'd like to see patients with whom you had a visit with last year, then click Yes. This is useful if you want to understand if you had a chance to opportunistically screen. All of these filters and the resulting changes to the graph stay saved until you restore your settings. If you'd like to change any one thing back, simply deselect a choice you've made. If you'd like to reset all of your data back to the original settings, go to the collapsed menu hamburger icon at the top right of the screen. Choose Restore Default Report State. All of your results will revert back to the original settings. Below the graph, you can view the number of eligible panel patients with and without screening for the measure. You will notice that one of the numbers is bold. This highlights the actionable information for this measure, in this case, those who have not been screened for diabetes. Double-clicking on these numbers will reveal the personal health numbers from your confirmed patient list. If your report is based on a proxy panel, the PHNs will be scrambled. About the measure includes information about the data calculations, the numerator and denominator, and information about the data sources. Clicking on the Questions to Consider and Resources link will reveal a pop-up window that offers some suggestions about how to interpret the measure, some possible actions that you could take related to the measure, and links to other resources. This gives practical points of reflection for you and what the measure means to your practice. We have consulted with a number of partners for this information, and we link to their resources should you want to have more support to prompt a quality improvement initiative. Click on a partner external link to see questions and resources available to you. These links will open in a new tab. If you are a delegate for more than one physician, you can choose which physician's report you want to view. There are two ways to change to a different physician when viewing the report. Note that you must know both ways, as the changes you make are only applicable to the report area you are in at the time. First, from either the Home or Home Continued page, You can click on the Physician Default Settings page tab at the top. The first box on the left is labeled PRAC ID. Enter the practice ID for the physician's report you wish to view and hit Enter. This will set your report to the physician parameters that correspond with the PRAC ID you entered here. Note that the report that changes is only your home report. This change in PRAC ID won't carry over to other sections. You will have to change these in each section you view. The second way to change a physician's settings is from the Measure page. At the top of the Measure page, you will see information about the physician, including the PRAC ID. Enter the practice ID for the physician's report you wish to view and hit Enter as you did from the Physician Default Settings page tab. The report will change as it did before. If you have any questions about your digital primary healthcare panel report, please contact the HQCA team. They alone know that you have registered for the report, as they protect your confidentiality. So ask for the panel report team if you have any questions about access. Thank you for learning more about the digital primary healthcare panel reports.